Hi, this is Starkie Sowers. Welcome to another Plus Program training series. Today we're going to be talking about cardiovascular health. And when we talk about cardiovascular health, I think it's always important to understand, all the parts and pieces. So when we think about blood system, blood's, traveling around the body on a regular, every minute, every second basis. And remember that blood has a couple unique things. Number one, it brings oxygen to the brain as well as to all the cells in the body. The other thing it does is it scavenges up carbon dioxide. So it's critical that we have fresh blood just constantly rolling all the time. So what are the systems, so to speak, that make that happen? First of all, obviously, we have to have the heart, which is really a strong muscle area that contracts and moves the blood around the body. So the other thing is the arteries, which kind of receives the blood. And then it kind of takes the arterial system changes a little bit. When the first artery, when it comes out of the heart, is literally about the size of a garden hose. And so as it travels along, it goes into what we call arterioles, and those arterioles are about the size of a pencil. And finally into what we call capillaries, and those blood capillaries is where all the exchange, so to speak, takes place between the cells, and they're about the size of a hair. So you can see the big diversity or the change, so to speak, in the sizes of the arteries to the arterioles and then finally to the capillaries. And then you have the returning blood supply, which is the venules and the veins. And that, of course, takes the deoxygenated blood back to the heart. And in that exchange process, it goes through the lungs and returns back. And the gas exchange happens in the lungs where we actually remove the carbon dioxide and bring back in fresh oxygen, so to speak. So kind of gives you an idea of all the parts and the pieces. And typically what goes wrong with the vascular system, so to speak, is what we call atherosclerosis or arteriosclerosis. Arteriosclerosis, of course, means hardening of the arteries, and atherosclerosis means hardening of the arteries as well as other areas of the vascular system. Remember that all of it is muscle all the way through. There's constantly this motion of contraction and relaxation, and we'll have a little bit of a look at that in a bit. Typically what goes wrong in that situation with atherosclerotic plaque development, pieces of this plaque can actually peel off, so to speak. And if they lodge themselves in some of the small arterioles or capillary systems in the heart, it actually produces what we call a heart attack. And then, of course, same situation, some parts or pieces of these atherosclerotic plaque can peel loose and deposit itself in the brain, and that's what we call a stroke. Obviously, the other things that we can have is poor circulation as well as high blood pressure. So that kind of gives you like an array of it. So let's kind of take an in-depth look, so to speak, at atherosclerotic plaque development. So when we look at atherosclerotic plaque development, basically what it is, as you look at the pictures, we see like an increase of thickness in the intramuscular area of the artery. And so it's kind of a fluffy, loose plaque, and sometimes it hardens up. And when it hardens up, it causes a hardness of the artery. And so one of the reasons why that becomes so critical is when the heart pumps and releases the fresh blood into the circulatory system, the big arteries themselves will expand up to 2 times their size. They're very elastic, so to speak. And so if these things become more rigid, then what happens is the blood pressure goes up because there's less expansion and just dilation of those arteries. So it creates what we call increased blood pressure. And as you look, a lot of different charts will show you that as you get older, this has a tendency to happen. So let's look at some of the factors that cause atherosclerosis or hardening of the arteries or that plaque development. First on the list, we've all heard about cholesterol. Remember, there's different types of cholesterol. There's good cholesterol and there's bad cholesterol. The HDL is the good cholesterol and the LDL is the bad cholesterol. I say it like this: the HDL picks up concrete off the arteries, the LDL lays down concrete on the arteries. And it's a process that the body does on a regular basis. The other thing that becomes very critical as well, too, is what we call homocysteine modulation. So homocysteine is kind of a big word, and it's getting a little bit more easy to say. Some people feel a little bit more comfortable with it. Homocysteine is it's an amino acid that kind of the metabolism just goes kind of funky, so to speak. And you need vitamins B6, B12, and folic acid to prevent the buildup of homocysteine. But what homocysteine does is it kind of challenges the integrity of that muscle tissue. What it does is it kind of causes like a cutting or a tearing action on it. And so then the body will actually heal that. And the way it heals is that it uses cholesterol to kind of band-aid that up. And that's a regular process that goes on a daily basis. The question that you always want to ask is how much of it is going on, and homocysteine can be a factor if there's too much of it. So with that in mind, let's kind of look at that whole HDL, LDL thing. Remember that HDL and LDL, you want the balance between those cholesterols so that way the body's not depositing too much. if you've got too much LDL in the system, there might be actually something going on. And so checking with your physician and making sure that he kind of maybe details that in will give you a little bit more introspection. So one of the things that I want to talk to you about as well too is the integrity of the collagen fibers, those elastic fibers that, that open and contract. Those are collagen fibers. In order to keep those things healthy and not ripping and tearing, vitamin C and vitamin E needs to be at optimal levels in the body. So that's where antioxidants become a real critical factor here as well too. And finally on the list, what we do know is this, is anytime there's an increase of obesity, obesity raises up the LDLs typically and causes what we call insulin resistance, and it piles up glucose in the system. And so what that does is cause the body to deposit more fats and create the production of more fats, and the LDLs have a tendency to go up. So that becomes a very strong risk factor as well too. So that being said, that's a very modifiable risk factor when we think about it. Reducing body weight and getting that in check becomes real important. We're going to talk a little bit more about that in session number 2. So, and then finally, when we look at it, smoking and drinking, we definitely know smoking is one of the #1 causative factors for increasing cardiovascular risk. And when you combine it with out of control drinking, it definitely creates an issue. And so I know I can hear a lot of you guys saying now, well, I drink 1 glass of red wine a day, or I drink red wine. And remember, to be healthy, it's literally about 1 or 2 glasses for men and 1 glass for women. And that glass size is small. It's like 4 to 6 ounces. It's not like 14, 24 ounces of wine. So when you think of that, remember it's a small portion. And so, don't think that it gives you liberality, so to speak, to use the combination of large amounts of alcohol while you're smoking, thinking it's going to maybe equal it out. So that kind of gives you a little bit of a wrap up on what cardiovascular system is. So once again, we've got the heart, the artery system, the capillaries, which freshly delivers that blood supply. And remember, it's going to kick out literally about 5 liters every 20 seconds. The average heart beats roughly about 60 to 80 beats a minute. And at the end of the day, it's about 8,200 liters of blood being pushed around your body on a daily basis. So that kind of gives you a little wrap up story. And we'll look a little bit more details on some dietary things that we can do in session number 2. Thanks for watching.